Well, thank you. It is a pleasure to be here, and on a topic that most people look at and say, wow, I wonder what he's going to talk about. Let me first just give you a little background on myself. I've been in practice in Duluth for 28 years in the field of obstetrics and gynecology. I actually did a lot in the surgical world there, became involved with administrative work as well with Essentia. Decided to retire this past year, mainly because all of that, particularly in the administrative side, I was kind of getting burned out a bit. But also, my wife and I had always wanted to, in a sense, go back and serve in a smaller community. And both of us love the Northland. We're one of those weird people who like all four seasons, including winter. And so when I retired, I immediately started looking, and I had worked with a number of the doctors here in Grand Rapids. Always been very impressed with the care that was provided up here, and they had an immediate need to fill a position, and it was a match made in heaven. I've been very glad to be here since July, thoroughly enjoying this community, as is my wife as well. I still have to ask many directions, because most people, point out things in a community based on things that locals would only know. So I'm still learning how to get around and things like that, but it's been a lot of fun. Let me tell you a little bit about this talk, and this talk actually came about because I was asked to talk to a large community business leader group about artificial intelligence in medicine, and so I kind of thought, wow, I better learn about this a little bit, and so I started speaking, and I since also was asked after that to speak at a couple of larger colleges, Concordia over in Moorhead, and others that have asked me to kind of talk. Now, my reason for talking is just to, more than anything else, raise awareness. As I was telling to Cassie and Jillian ahead of time, what we're seeing, and everybody in this room realizes, is what we're seeing is just an explosion of technology today that is just climbing through the roof. And it's amazing stuff. And if you do a talk on some of this stuff, you talk 1 week, 2 weeks later, it's out of date. I mean, things are changing so rapidly. But part of my reason for talking is that a lot of times when things move quickly, we don't have time as a society or as a community to maybe ask the questions we need to be asking about what's going on and what's there. So what I'm going to do is I'm going to be raising some questions, and we're going to have some chance to dialogue during, but more at the end. But it's more to raise an awareness. And so you can see what's out there, what's coming, and you can just get a sense as well about what questions do we need to be asking as society so we can ensure that this type of stuff is used properly, and things like that. So I'm not one presenting with all the answers here today. If more often than not here, I'm presenting a question to you that I think we all need to engage in, and that's important to engage in. We're going on, and obviously here's a picture of our physician, and here's one of our modern robots that are out there. But I'm going to mention that there's really, when we look at medicine, there's four technologies that are just exploding, and we're not going to talk about all of them. One of them is genetics and microbiology. Again, only recently we got into the fine details of DNA, and what's being done now is how can we look at a person's DNA and target specific issues with their DNA, or how do we looking at DNA, make sure that we're treating things appropriately. In other words, let's just take something simple like high blood pressure, hypertension. Well, we might find that depending on your genetics, we might treat it differently. All of this is in its infancy, but again, it's just exploding right now. Nanotechnology. Nanotechnology is the real small little things that you and I can't see down to a microscopic or level below, but ways that nanotechnology is getting into getting medicines into our system or things like that. All of this greatly exploding. Neither of these things we're going to talk about. What we are going to spend a little bit of our time today on is a little bit of robotics. We're going to show you a little bit how robotics is used, and robotics has some different connotations, and we'll talk about that. And then we're going to talk specifically about artificial intelligence. This is a quote that I appreciate. It's from about a decade ago, but I think it's as relevant today as ever. The myths of yesterday become the technology of tomorrow. And isn't that true? Now, this is kind of the outline of the talk. We're first going to go through some definitions, okay, just so we understand what is meant by certain terms. And then we're going to talk about how information management is changing today in medicine. We're going to talk a little bit about robotic surgery, which was a love of mine in my previous job. And then artificial intelligence. We're going to talk about, as a group, we're going to look at this, what excites people, what's really exciting about what you're seeing. But then we're also going to address, are there any concerns that we have to be aware of? Right off the bat, I want to take us through just a couple of definitions. We hear the word autonomy. And if we look back at the Latin of the root, auto is Latin for self. Nomos is Latin for law. So when we hear the word autonomy and we go back to the root of the word, it really means self-law. In other words, whatever is autonomous is making the rules up as it goes. This is something that I threw in because I think as a society we've sometimes mixed up the definitions of autonomy and freedom. And depending on the group that I'm talking to, will speak a little bit different. But again, autonomy is self-law. Freedom actually always has boundaries. And people, I think, today don't recognize that. But freedom, when we use the word freedom, it always refers to there's going to be boundaries put on it, and there's also going to be a responsibility that's associated with it. Autonomy isn't that way. In fact, if we think of autonomy carried to the nth degree, what do we have? We have chaos. If everybody's just doing whatever they want with no regard for anybody else, it's basically chaos. Freedom is different. Now, let me just give you an example of that. Every one of us here has the ability to hop in our car, go on the road and drive to anywhere we want in these United States. We have that freedom given to us, and we have the technology that does that. And it's a wonderful freedom. Not everybody in the world has that kind of freedom, but we're free to go anywhere we want. But are there any boundaries on that? Sure there are. We have to drive on the road. We have to drive on the right side of the road. We have to obey traffic laws. We're not autonomous when it comes to being on the road. We have to follow the rules that are put before us. And what's our responsibility? We have the responsibility of being a good driver, so we don't injure ourselves or anybody else. So that's the freedom of going into a car and driving anywhere we want. And we're free because we abide by those laws and that responsibility. Just think if there were no traffic laws and anybody could drive anywhere they wanted, any way they wanted, we'd have nothing but chaos. But that's what true autonomy would lead to if everybody was autonomous as a driver. So a little bit of a distinction between autonomy and freedom. Second definition, robotics. Now what I'm going to talk about mostly is what we call slave master. Now that's kind of maybe some words that you're not supposed to use. But when we're talking about robotic surgery, there is no autonomy by the surgical robot. It doesn't do anything that I'm not immediately telling it to do. It has no ability to do anything on its own. So really it's a slave robot. We also, if you think of the word robotics, there's pre-programmed. Think of the automation of a car assembly plant. Those robots are pre-programmed to do a certain thing. They're limited in their scope. They do it exceptionally well, but it's all because they're pre-programmed. The other what we're seeing in the world of robotics is now, and it's tied into artificial intelligence, robots that develop some level of autonomy where they're able to make decisions on their own. So you can see the three different layers that are there, and obviously this is where things are moving to more and more today, and you'll see that a little bit in the talk moving forward. Now, artificial intelligence. Think of the artificial intelligence as a very powerful computer, but it has these abilities. It's able to self-learn. So in other words, it's not entirely relying on what's been programmed into it, but it has the ability to learn as it goes. That's a whole new concept, but that's one of the key concepts with artificial intelligence. And because of that, there's some level of autonomy given to it. Okay? So now we're giving to a computer the ability to, in a sense, make its own laws and decisions as it goes. It becomes, in a sense, self-programming. It can rewrite its own programs as it goes. So some of those constraints that have been there before are starting to weaken. This is just a point, there's a definition called singularity that's out there, and you may or may not have heard of it. It was coined by a fellow by the name of Ray Kurzweil. He made this a number of years ago, 7, 8 years ago. He says at some point in the future, a computer is going to have the ability to exceed the capacity of the human brain. And most people feel we've kind of crossed that barrier in the last year or two. So that's the point of singularity. So the power and the speed and the capacity of the computers is now exceeding that of what our human brains can do. So we're just trying to do here is to set the stage a little bit for what's out there. Now, taking a step backward, I would say, you know, where is the world of computing in that changed us in medicine? Well, certainly it's the whole area of information management, you know, and so when we look at the explosion of technology in that, you know, medicine has its own search engines, and it's right there in my computer in the office. One of them's called UpToDate. You know, if a patient presents with something and I'm not overly familiar with it, I can just go right to UpToDate, type in that information, and I get boom. You know, the most immediate studies and everything that's up there. Wonderful things to have that are immediately available to me. It's, you know, it's like a Google, right, but just right for a physician. Computing has the ability to help us with diagnostic algorithms, where a patient comes on with these 5 symptoms and et cetera, we can plug those in and help a computer to say, okay, these are the things you need to consider, these are maybe the tests you should do. Now, in general, we have that capability within our training, but there's always the ones that are a little bit out of the ordinary or something that's not something that you're familiar with. We now have with computers the ability to have that aid of approaching patients when they come on in to make sure we're not missing anything. Obviously, we've got the electronic health record that has been somewhat cumbersome, but is continuing to improve. It's a wonderful modality. Everything is on computer that we can pull up. Most, at least within Minnesota, almost all health systems use a similar form. So if you're in Ascension, Duluth, or down at the University of Minnesota, or down at the Mayo Clinic, we all can share records and view records from each other. That's just wonderful in terms of expediting care and providing continuity of care. We can access a wide range of things. We can store images if you have a CAT scan or anything like that. All of that's stored within your personal record. And obviously it's very transportable. You know, again, you don't need to transport it anywhere in Minnesota or to most big institutions because we're all in the same type of a program, but if not, we can put in a, you know, make a copy of it for you and send it with you as you go. But so the computers have greatly helped us when it comes to information management. Now, a little bit on surgery, and I'm going to show just a little bit just to update people on where the world of robotics is. I did robotic surgery for about 8 or 9 years. These are found in your bigger institutions. Duluth would have it, University of Minnesota, Mayo Clinic, in that. As you'll see, they aid the surgeon a lot. We can do some very intricate surgery with it through some very small incisions, but these are highly expensive instruments to have, and are we going to see one in Grand Rapids? I don't think so. I don't think we should. It's not good use of the healthcare dollar. But this will just give you an idea of some of the way that robotics has helped us here. So what it is as a surgeon, the surgeon is no longer at the patient. And so as a surgeon, I'm sitting over in what's called a console. Patient may be over the other side of the room. I'm sitting in a console. And I'm controlling on what, if any of you know, if you think of what it's like to play an organ. You're playing two hands and you're using your feet on various pedals. Literally, that's what we're doing. And as a surgeon, we're controlling all these arms to a very fine degree. Now, we're just going to show a short video here, but it just gives you an example. But you'll get an idea of the precision that we can do with some of this instrumentation. So it's a slave master, that's right. It's only doing what I tell it to. And again, I'm looking into actually to a three-dimensional screen. One of the main reasons when this technology came out that we started doing it was because it was the first time ever we could do surgery in 3D. Now, our regular laparoscopy, we have the ability to do it in 3D, and we do have that technology here in Grand Rapids. So 80% of what I did robotically before, 80% just with the 3D laparoscopy we can do here. Well, robotic and laparoscopic are all minimally invasive, so the patients are really, the recovery is going to be the same, is that you can do just more complex things when you're robotically. When we do laparoscopy, the instruments we put in are fairly rigid. I mean, there can be a scissors or grasp or things like that, but think of them as sticks with instruments on the end, and so we have to move the whole stick. As you could see from the robot, it's still the laparoscopy, but the end of it is multi-articulated. So, it can do like this. We don't need the multi-articulation for everything, but for some things we do. For certain cancer surgeries, it's when you have to do lymph nodes or things like that, the robotic is very wonderful. So there's definitely a role for it, and it's revolutionized certain types of surgery. At Grand Itasca here, there's most anything that's done with general surgeon or done with a gynecologic surgery, we can do just about everything here. And a fair amount of orthopedic has been done. We're growing the orthopedic surgery program as well. That's our big area of growth moving forward. There's always the balance in surgery, because whether it's not so much just the surgeon, but it's the whole team. To do a surgery and to do it well, you have to do enough of it at a particular location to do it good. Grand Itasca should never be doing something that we do 3 a year of. You can't be good enough when you're doing 3 a year. You need to be doing 3 every couple of weeks, you know. So you need to have a volume. Now that being said, 80–90% of surgeries that the general population needs, yeah, we can probably do them here, but some of the big things, some of the things that should be done robotically, some of the advanced cancer surgeries, those should go to centers where they do a high volume of it and they have people that are very specifically trained in that. Many things are done in Duluth, and if Duluth can't provide that service, certainly the university, Mayo. The nice thing in Minnesota is we've got a lot of really good options in terms of advanced surgery. The advantages of this, it's very precise, it's 3D, and 3D is a difference between 3D. Think about if we're operating in 2D, that would be like you and I operating or doing something with one eye closed. That's two-dimensional, basically. Three-dimensional is both eyes. So this was 3D. It's very minimally invasive. It's very good for the patients in terms of hospital stay. The cost for that instrument is, or that robot is $2.5 million. You know, so it's not inexpensive, and the only way to make it, in a sense, cost effective is you have to do a lot of surgery on that. You have to keep using that robot continuously. It also doesn't make you a good surgeon. You know, you can use it, you can get to be a better surgeon, but it itself won't make you a better surgeon. The point is that you can see somehow where these technologies are moving. And again, the 3D laparoscopy came after robotics, and again, much less expensive, but that's technology now that we do have here, and we can see with that level of precision just with our regular laparoscopic surgery here. Now, here's where we're going to take it. This is a little longer one here. Here now we're going to shift over and see how robotics is being used and AI is being used in a different manner here.
I don't know how you're supposed to feel at 86, but I don't think I feel like I'm 86.
Surprise!
People make my world go round. I fear isolation and being cut off. If I am alone somewhere and I had no one to talk to, no one to share anything with, I bet you I would just dry up and blow away. I call this my smart house. We got sensors in all the rooms. I swallow them. I wear them. Doc knows what's going on with me. I don't have to go to the clinic anymore. I call him up. He's not back in the horse and buggy days.
Looks like you had a pretty active week, huh?
I'm feeling it too. Hey guys, how do you like your ride? Knowing I got eyes on me gives me the confidence to keep me being who I am. Doing what I want to do frees me up. Takes the worry away. I don't have to worry about Paige, my daughter.
Hey, Dad.
Hey, kiddo, what's up?
I'm just checking in.
Because I know she's not worried about me.
No, I'm...
She's always busy, work and kids. But she can see exactly how I'm doing.
I love you, Dad.
That she knows how I feel before I do. Cookie has become my buddy.
Time for your pill, Jim.
My wingman. Hey, Cookie, what time is that car going to be here?
2 minutes. It's cold out. Might want to bring a coat.
It's like he has a brain. Now, what are you doing, Cookie?
It's a quick
I have
procedure.
come to
Doctor
rely on him.
said
I know I can trust him, and he's got my back. I lost Ellen, my wife, 10 years ago. So many good times, so many memories. Losing her was really tough. If we had had for her then what we have for me now, she would have been in a much better place. I miss her so much. Here, not too long ago, I was experiencing those dizzy spells. The doctor had provided a scan for me at home, so I didn't have to go out to the clinic or anything.
They have those scans for that patient. Take a look.
And that scan revealed that I had an aneurysm. I saw this specialist, a surgeon, and she explained to me, we wouldn't have a messy operation. They inject these nanobots and they go into your system.
Basically, we're going to send in an army of nanobots of the aneurysm.
And they find where the aneurysm is and
Fixing it.
they seal it off. I get a kick out of thinking that I have a whole bunch of nanobots swimming around up here in my brain, doing what they're supposed to do. I wasn't in a hospital. I was back home.
Oh dear.
I was back home where I want to be, where I belong. The help that I have allows me to stay here in my home. Who is that? Do you remember? The guy in the back.
Who is that?
Have my friends here,
That's Pete.
my family, and I don't want to give that up. I don't want to be in a nursing home. The quickest way to lose your independence is to go where you don't have any independence. That's the truth.
Not that far from where we are reality today. That's all that stuff is in prototype. Healthcare manager, AI robotics healthcare manager, he's got his little friend Cookie there, ever present, precise care, companion, communication portal, providing memory, what time's the car coming? It's made to sound extremely good. And obviously there are companies that are spending enormous amounts of research and development to put this type of programs available. There's always there's some level of autonomy that's given to these robotics or whatever as well. But there's a lot of exciting things there when you think about it. The world of medicine is going to rapidly change. The joy of being part of it is trying to figure out, well, what's it going to look like in 5 years and in 10 years and then. Because I think our imaginations are at probably well under what it's really going to end up being. Every year there's a conference that put on by University of St. Thomas, and it's called the Future of Healthcare Conference, and it's a whole day of corporations, et cetera, kind of coming in telling us what's out there. Apple is also working on for remote parts of the world where you can diagnose, at that time they said 25 to 30 various diseases based on a little blood sample put onto the phone or a little urine sample put onto the phone. That's where that's what they're, again, it's an R&D, but that's the technology that's out there. And you think of the third world and being able to impact their health, what a marvelous thing that would be. I hadn't heard of that Fall app, but what a great thing. What else excites you about some of this stuff? And again, this is just a very small tidbit of what is being developed, but essentially had me spend 2.5 years in Fargo as their chief medical officer and their chief of surgery, and I was helping out there. But we had a surgeon there who did facial reconstruction, one of very few in the country, and he was a phenomenal surgeon. But he had a 3D printer himself that if he had to reconstruct something, he could get a mold out of the bone. Every one of our in the military, every one of our special forces has a total body scan now, so ahead of time, so if they ever get injured, they can 3D print some body parts. The only thing they can do, obviously, is stuff like bones and that type of thing. But again, that type of thing's exploding. They're finding ways to reconstruct organs and that though too. So, what I'm telling you now and what's available in 5 years, who knows? But a lot there. Transhumanism is maybe a word that's used with that, but actually they're taking animal labs like rats and things like that, and actually now they can replace part of their nerves or whatever with human nerves, and then they can do testing models for like MS and Parkinson's and things like that, but they're actually embedding human cells within laboratory animals and using those for test models. Now, I know that's being done. I really don't know the intricacies of where they are at, but that's kind of where the testing is going a lot right now on those types of things. Again, those raise, questions, concerns, and that a lot of this boils down to our technology is going through the roof, and we haven't even taken time as a society to ask, what are the questions we need to be asking? And again, part of the reason we're having a discussion like this, more to raise questions. That technology is there, mapping brainwaves and interpreting in that. And you're exactly right. You think of what's the exciting things that could happen. How could that be utilized for somebody who's paralyzed to be able to cause an exoskeleton to be able to walk again? Wonderful things. On the flip side of the coin, if used inappropriately, it's kind of a scary thing, isn't it? Yeah. Data crunching. I mean, computers, the faster the computers are, the better they can crunch data. And particularly if we can give guidelines in that, there's a lot of things that we can learn from collective experience, not only locally, but regionally and nationally and worldwide. There's no question. And that's being done. A lot of the research that's being done in medicine now is because of the connectivity that we have, we'll just say through the internet, that we, even rare situations, well, if something is rare in Minnesota, but if it's there's enough going around the world, you can learn from it. Yes, there's a lot of wonderful things that can happen when you have access to all that data. Well, it's kind of endless possibilities. Any concerns that people have that causes you to pause. That's one of the things here, and this is in medicine always. As our technology expands and we can do it, it comes as a price. I mean, a lot of these things are very expensive. How do we, as society, afford it? Those are good questions. I was talking with Jillian and that, when they're starting to look at, if a person would develop cancer, and now with genetics, they can look at your genetics with some cancers and say, okay, what's the best treatment modality for that? That's really expensive stuff to do. Is it if it's making a difference in outcome, maybe as a society we say that's worth the cost. A lot of things are always, what can we afford, and what's the benefit gleaned from it? But as these things explode, these are some of the questions that we need to be asking. In that cost, unfortunately, if money grew on trees, there's a, and cost wasn't an issue. It makes different decisions, but as a physician and as we get into making decisions, unfortunately, cost always is, and not that we want to deprive anybody of anything, but let me give you an example. If you've watched TV, and I don't even remember the name of it, but if you've seen those ads for small cell lung cancer, and they're pushing this drug that if you get stage 4 lung cancer, that this drug can improve your length of life. Now, here's the fine print that they don't tell you, is it the survival of stage 4 lung cancer typically is less than a year. This drug, at 3 months, if you're using it, you're much more likely to be alive. At 6 months, you're much more likely to be alive than if you weren't using it. At 9 months, you've caught up, and the death rate is the same. The cost of that drug to potentially get 3 or 6 more months of life is over $250,000. See, they don't say that on TV, but it's over $250,000. And there's those decisions that you've got to make, knowing that this is something that could break the piggy bank. And at 9 months, it's not going to have made any difference. But that's what we have to wrestle with as a society. And I think a lot of this advanced technology is going to fall into that. Now, you know, that being said, as we get better and better, cost of things goes down. Unfortunately, I think most of us in this room remember when calculators first came out, you know, I remember in high school trying to plead with my dad to get me a calculator that did 4 things: add, subtract, multiply, and divide, and it was $200. You know, and that was back in the 70s. In $200 in today's world would be, you know, over $1,000. But, you know, nowadays, you know, they're 99 cents. You could get a calculator that does 100 times that. I'm going to raise just one concern that I want you to think about here. You know, there's a lot of sharing of data for this whole thing, but on the flip side of the coin, you share a lot of data, make it accessible. There's a loss of privacy, and I think that becomes an issue. And the more we give out, and we, you know, if you just like, you know, Alexa or something like that, you know, if things are not, if Google doesn't use our information wisely, you know, and selling it to somebody else or things like that, there's a potential loss of privacy. So I think privacy is always something that we need to be asking. Are there constraints on that? You know, where I would say we are today is we have some very noble goals, but we don't have too many safeguards out there. And I think that's where the community, society needs to be saying, okay, we love the goals. We want people we want technology to help us more, but right now we're moving so fast that we don't have safeguards on. And I think we have to be vocal in our desire to have safeguards placed. That's a personal bias of mine with this. But the potentials are there for some very wonderful things. I would say nobody's talking about it. And you know, a lot of this technology are small little companies scattered all over. The FDA has no control over most of this stuff. And you know, is it government's role to put safeguards on? At least in part. But that's hard for them to do that on something that's very broad and hard to define. And again, literally, part of the reason I like to do this talk to community groups is it really boils down to us as a community, a society, to say we need safeguards, and at least to put them up there. I don't have the answers, but let me give you an example from Britain. And this is reality. But in Britain, they've got, and we even have standards here that Britain doesn't have, but Britain has been combining genetics of humans and animals and breeding that. And in Britain, they can do all the experiments they want. I mean, combining human genetics with pigs, combining human genetics with dogs, cats, whatever. And the only thing is that they have to abort them by 14 weeks. But I don't know about you, but ethically I kind of go, oh boy, what are we getting ourselves into? It's a whole topic called transhumanism and beyond maybe the scope here, but it's truly an example of some stuff out there where no one's regulating it. And the technology is there to combine species. Who's watching it? Don't know. That's a tough one to swallow all of a sudden, but it's a real one. It's a real one. Well, cloning is supposed to be in a sense within a species, but this is a step beyond that. Well, now they're bringing species together. Well, any other last comments, questions? Telemedicine is the broader topic of what we're doing there. And even that is something that's developing legislatively. But there are certain aspects of medicine now where, in a sense, it's almost a Skype meeting between the doctor and the patient from one computer to the next. A number of small town emergency rooms have a small, I don't want to say robot because it's not a robot in any sense, but where through a screen and the ability to, with this instrument they can listen to the heart and lungs, so you can have a physician assistant out in a small town emergency department, not a physician, and they can, using this instrumentation, call down to Hennepin ED or St. Mary's in Duluth and be connected to a doctor there so they can help with the diagnosis. So that type of thing is already starting to happen. Wonderful applications, particularly in small towns, in that. Again, very expensive infrastructure, even to do simple things like that from one emergency department to another. The technology's there, the cost is there. I think there's going to be an increasing role for that. The government gets involved, and the government says, well, the doctor is in Minnesota and the patient's in North Dakota. You can't do that because the doctor's not licensed in North Dakota, and there's more way, unless you pay your money, type thing. But it is something that I think telemedicine in general, what we're referring to, I think that's going to increase quite a bit. It'll be up to the patient, in the sense the consumer, to say, that's an interaction that I like, or maybe it's an interaction I don't like. Some of that might be generational. Us older generations tend to like the personal, the personal touch. Today's millennial generations, who are on their iPhones all the time, might be very happy with it. So we might see some variation based on which generation you're part of. But it's out there, and it will be increasing. I hope you've gained something from this. If nothing else, it's piqued your interest to maybe do a little research on your own. Well, thank you for the opportunity. This has been a pleasure to be with you this evening.